introductions. Then we're going to move into the bills, that potential topics of conversation with which you can have with your policymakers. And then we'll save some time at the end for any questions that you may have. If you have attended or had attended the first and second briefing for Days of Action 1 and 2, you'll notice that this agenda is much shorter. We have cut a couple of items just because we believe that you are familiar with kind of the process by this point. That information will still be provided to you by email, but we won't spend time going over it this evening, so you can get it in, so we can get in and out of here as quickly as possible, as efficiently as possible. And that opens up more time for questions at the end of the call, should you have them. So first, I think before we go into introductions, we need to do a sponsor spotlight. So I'll hand that over to Greg.
Thank you, Matthew. And thank you to our sponsors. We could not do this event and this series of events without your support as sponsors. So thank you, AbbVie, a new sponsor for NAMI Texas Days of Action and Rally. They're a platinum sponsor. Thank you, Otsuka, for being a gold level sponsor. And as announced in our briefing last month, Neurocrine Biosciences is also a gold level sponsor. So thanks again to our generous sponsors for supporting our advocacy work. If anyone is interested in a custom sponsorship package, please reach out to me and I'd be happy to work with you on that. Thanks everyone. Matthew.
Okay, so now we'll stay with Greg and he can provide a quick introduction of himself.
I will be very quick. I'm the executive director of NAMI Texas. I was the policy coordinator before, well, actually, when I first started, I was policy coordinator for the first couple of years, and I was policy director for a few years as well. And I am just thrilled by how our advocacy is shaping up this legislative session. You know, it's a very different legislative session than we've ever had before. With COVID-19, we were not at the Capitol quite as much as we usually are. However, that started to change, and we've been down there quite often recently, especially Matthew, and I go down there every so often as well. But you know, most importantly, with this legislative session, we have found a way to engage advocates, and we've been getting advocates in front of elected officials. So that those advocates have the opportunity to share their story about how their lives have been impacted by mental illness and ask for their elected officials to take action to fix the gaps and the issues within the mental health system. So that has been a success thus far, and I appreciate everyone who's been involved in those initiatives this session and going forward.
Excellent. Thank you, Greg. And as I mentioned at the top of this presentation, my name is Matthew Lovett. I'm the Peer Policy Fellow with NAMI Texas. I have not been around as long as Greg has, but fortunately, I have been able to absorb or, assimilate a lot of the knowledge he's gained over the past 10 years. And the product of that process are these NAMI Texas Days of Action, which are, like Greg mentioned, an opportunity for advocates to connect with their policymakers in a virtual environment so that they can remain safe during the COVID pandemic and also going to the Capitol, which can be a little bit dicey sometimes, only because the amount of people that are there and the relaxed safety measures that have been put in place since the governor reduced the mandate or eliminated the mask mandate and social distancing measures, so forth. Anyways, beside the point. So welcome, guys. Thank you so much. And going to that third introductory item, NAMI Texas Days of Action, Greg alluded to it already, but, and I believe the majority of you who are watching this have been on or participated in previous Days of Action. But briefly, advocacy to NAMI Texas advocacy is essential in improving access to and availability of mental health services across the state of Texas. Advocates who are able to effectively and efficiently share their stories of mental health and recovery can help to shape policies that determine the quality of care provided to those most in need. NAMI Texas Days of Action are our way to support you in direct advocacy with policymakers, to provide you with an opportunity to share your mental health stories, express concerns about the state of mental health care in Texas, and provide potential policy solutions. This coming Friday, which is March 26th, will be the third NAMI Texas Day of Action. We will also be holding the fourth and final day of action on Friday, April 30th, which will be preceded by a mental health rally. Not on the Capitol grounds, mind you, it'll all be virtual again, but we're still going to participate in that biennial celebration of mental health policy advocacy. In the email distributed last week, I provided each outreach group the time of their legislative outreach session and the person with whom they would be speaking if it had been scheduled. I've had a couple more appointments scheduled since then, so I will be able to provide you with that information tomorrow or Wednesday, so you can be fully prepared to have that conversation on Friday, in addition to a sample script, which you guys were provided last week as well. Tonight, we're going to review a few bills that may serve as potential topics of conversation for your outreach. However, these are just suggestions. By no means are we going to limit you to these bills as potential topics of discussion. If there's something that's relevant to your affiliate or your community, you're more than welcome to discuss those things as well. Yeah, I think that about covers it. So with that said, we'll just jump right into the bill discussion piece. So first, we'll start with the Senate side. And we got 3 bills on the Senate, we got 3 bills on the House side. So you'll notice, or maybe you won't notice, there's only one senator who has signed up to speak to advocates this day of action. So 2 of these are going to be directly targeted for that senator, which is Senator Powell of the Fort Worth area. And then one is just a general talking point. It would be good to speak to Senator Powell as well, but you can also use these talking points to talk to your House representatives if you're so inclined. If it's an issue that's particularly important to you, or you think it's worthy of talking about and seeing what kind of support there is in the House side for future sessions or advocacy efforts. So the first bill we're going to talk about, SB 539, which is by Senator Blanco, requires HHSC to conduct a study on the availability, outcomes, and efficacy of mental health crisis response for individuals with mental illness, substance use disorders, and/or intellectual or developmental disabilities to reduce rates of incarceration, improve referral to community resources, and reduce use of force for people or on people in crisis. So this is going to look awfully familiar to if you participated, I believe, in our first day of action, HB 1050. It is the House companion for SB 539. So we've talked about this issue before, but only on the House side. We didn't bring it to the attention of the Senate side. There's been a lot of momentum behind HB 1050 and SB 539, so we wanted to bring it back up again, so we can keep it fresh. We can keep it fresh on the topic of conversation, and also because we're going to be speaking with Senator Powell's office. Senator Powell does sit on the Health and Human Services Committee, which this bill has been referred to. So this is a good opportunity to speak to Senator Powell's office about an issue that's really important to the mental health community and really important to NAMI Texas. And I imagine it's just as important to the affiliates as well. So what this as you can see in these bullet points, these talking points below, individuals with untreated mental health concerns are at an increased risk of victimization, suicide, and homelessness. Should an individual experiencing a mental health crisis, family, friends, and concerned bystanders may contact law enforcement. So the police may be the first to arrive on scene, or maybe the first person who tries to intervene in a mental health crisis situation. Unfortunately, police officers are often lack the skills or training to effectively de-escalate an individual in crisis, and the outcomes are often quite poor. We know that, but this study, what it would do would study the various mental health crisis response models being implemented across the state in Texas, and the idea being that if they can identify what's happening, then they can make suggestions for what maybe more sustainable integrated crisis response models may be across the state. It would obviously depend on the community, the resources available to them, and the people that they're serving. So some people may respond better to other kinds of crisis response than other people. So like I said, this is SB 539 is very familiar. We've talked about it before. This time we have a really targeted opportunity to talk to Senator Powell about it and really push this forward, because it's a really important piece of legislation. The second Senate bill that we'll be talking about this evening is SB 1142. This is a NAMI Texas bill. This is a piece of legislation that in conjunction or in collaboration with coalition partners, we developed the language to and are really championing the effort to get this bill across the finish line, so to speak. What it does is it prohibits commercial insurers from modifying a prescription benefit across plan years. For example, if one person is able to maintain their medications or they're on the preferred medications, then the plan year changes. They go from like 2020 to 2021 plan year. And then currently the insurance provider has the ability to change the plan benefit, so you may not have access to the same medication when the plan year rolls over. What 1142 does, or SB 1142 will do, is prevent insurers from making those between year adjustments in your benefit, so that you're not able to access the preferred medications. Keep in mind, this is only if individuals don't change insurance plans. So if nothing changes, you're on the same employer-sponsored health benefit plan, or you have one you purchase one on the market, and you maintain that plan from year to year, like you pay all your premiums and you meet all the qualification criteria, and you don't change anything. When it rolls over to the new plan year, nothing will change in your access to medications. Currently, that's not the case. And so obviously this can create all sorts of problems. People show up at the pharmacy, they're not able to get the medications, or they have to pay really exorbitant out-of-pocket costs to obtain their preferred medications. And if they aren't able to afford that, of course, the outcome likely could be a decompensation cycle where they just have a relapse of their mental health concerns. And then all sorts of bad things can happen from that. So there's a couple talking points as well. So you can use those data points in your pitch to whomever you're speaking to. I guess if it's Senator Powell, excellent. There are some talking points for you. If you're speaking about SB 1142 on the House side, of course, you can use those same talking points. Representative Lambert has the House companion for this bill. We're not speaking with Representative Lambert this day of action, but you're more than welcome to talk about non-medical switching if it's an issue particularly important to you, and you can mention Representative Lambert's bill. And if you want the bill number, of course, you can reach out to me and I would be happy to provide that to you. The third Senate bill is SB 218, requires the CHIP program to provide 12 months of continuous coverage to new mothers for postpartum depression. Obviously, this is really important. So if a mother has just recently had a child, they may be more likely to experience any kind of postpartum anxiety or depression, or there are a number of mothers who experience postpartum anxiety or depression, and then they don't have any resources on, benefits or coverage because CHIP Medicaid ends that coverage after a certain period of time. So the idea here is that we're going to be extending the coverage for 1 year. So new mothers are able to maintain or able to obtain the mental health care that they need to help better care for their child, to help improve their mental health after having a child, and to promote, continued well-being after that year ends. Again, there are some data points down here for you to reference or to use in your conversations. There's a lot more information on this topic, and there are a number of other bills related to postpartum health and mental health. If this is an issue that's particularly important to you, or if you find interesting, I'd be more than happy to provide you with more information on those bills. Just reach out to me and we can get you that information. All right, moving from the Senate to the House side, HB 88. This is by Representative Thompson from the Houston area. This is commonly known as the George Floyd Act. So it's a really lengthy bill. There's a lot of stuff in it, and a lot of it's police reform stuff. So it's there's mention of qualified immunity, use of force, de-escalation training, proportionate response, and progressive discipline for police officers that have a history of adverse outcomes when their interactions with civilians or people in distress. This bill has been assigned to House Homeland Security and Public Safety, which Representative Schaefer is a member of. So if you're speaking with Representative Schaefer's office, the George Floyd Act would be a good suggestion to take into that conversation. There are very few people who don't recognize the need or who are against police reform, and especially the disproportionate impact it has on racial and ethnic minorities. So if this is a particularly important issue to you, feel free to mention HB88 by Representative Thompson. Of course, there should be ample examples of people experiencing a mental health crisis who are confronted by the police and the outcome is negative, if not fatal. George Floyd, to be one. The next bill on the House side is 2595. This is by Representative Price from the West Texas Panhandle area, Amarillo, I believe, requires the Texas Department of Insurance, so TDI, to establish a parity complaint portal through which healthcare consumers and providers can submit suspected violations of parity law. So this, again, full disclosure, is a NAMI Texas bill. And what parity is that there's in statute, there are rules that say insurers have to provide the same level of benefit for mental and behavioral health care as they do for medical and surgical. It's in law that this takes place, but unfortunately there's not much oversight and enforcement. So there are still a number of parity violations that take place. So people aren't getting the access they need, aren't getting the degree of coverage that they need in order to receive necessary health care. So what NAMI Texas is proposing happen is that the Texas Department of Insurance establish a complaint portal that provides consumers and providers an opportunity to share suspected violations of parity statute, as well as to obtain any educational materials through this complaint portal. So this bill also requires TDI to develop some educational and training materials to educate the general public and also providers about parity, so that they are better able to spot it and better able to report suspected violations. All right, the next House bill, the final House bill, HB 705, is by Representative Moody out of El Paso, requires HHSC to establish a work group to develop rules for recovery community organizations eligible for Medicaid reimbursement, and requires HHSC to adopt rules related to the delivery of peer-to-peer services in a non-clinical setting. So recovery community organizations should not be confused with community recovery organizations. Community recovery organizations are substance use focused. Recovery community organizations, what this bill focuses on is putting in statute a definition of RCOs, which include both substance use and mental health, peer-directed, peer-led, community organizations that provide non-clinical support. So, a good example might be a clubhouse. So what this bill does is put the definition in statute and then opens up opportunities for future sources of funding for these recovery community organizations. That's the intent behind the bill. Although there's not a whole lot of like substantive stuff that is going to come out of this bill, it opens up an opportunity for funding for those peer-led organizations in the future, including mental health oriented organizations. Really important stuff. Obviously, we are big on Clubhouse. They do a lot of really great work. And so this would provide more opportunities for funding so they can provide more services to more people and maybe in different locations or new locations across the state of Texas. All right, I believe that covers all the bills for this evening. Let's see here. Questions. It looks like there are a number of questions that have popped up. Let me see if I can access the question feature, the chat feature.
Yeah, Matthew, there have been some questions in the chat, just a couple, and I think I got to them all just writing in response to them. I haven't seen any questions come through the Q&A. So if anyone does have any questions, please go ahead and type that in.
Everyone, I forgot to mention at the top of this conversation that this is being recorded and will be made available to you tomorrow. I'll be sending out the recording to everybody. So in the event that you haven't had an opportunity to write all the bill numbers down, this information will be distributed. I will also be distributing information on the bill numbers, like written information about all the information that was provided this evening. So I apologize if you've been frantically taking notes for the past 20 minutes or so. This information will be provided to you in a nice typed up handout with all the formatting and stuff like that. So make it a little bit easier for you to use in preparation for your meeting with your legislators and or during those meetings. SB 1142, does this include Medicaid? let me see here.
And I can answer that. Great question, by the way, Marilyn. SB 1142, which is the non-medical switching reform bill, does not include Medicaid. It only addresses commercial insurance, those that are fully regulated by Texas Department of Insurance. So Medicaid plans, Medicaid MCOs are not covered under this bill and would not be impacted by it in any way. However, I would like to refer folks back to a bill, and it's going to take me just a second to find it, a bill that we advocated for on Day of Action number 2. And that was a bill by Senator Buckingham, SB 674. This bill addresses access to antipsychotic medications in the Medicaid system. We know through data and through anecdote that the Medicaid system will often put in place prior authorization policies that either delay or completely obstruct an individual's ability to access care. And these are individuals with serious mental illness who have conditions like schizophrenia and bipolar disorder. These prior authorization policies have a dramatically negative impact on, most importantly, these individuals' quality of life. Vulnerable people in Medicaid who rely on access to the right care at the right time. This can really put them in a bad place to be blocked from access to the appropriate medications. And then additionally, another just relevant point, and I'm sure we talked about this when we gave a briefing for Day of Action 2, when these medication access barriers are put up, people are more likely to experience negative outcomes that come at a cost to the healthcare system and to the overall economy. Medication access issues will often result in hospitalizations, incarcerations, emergency room episodes, and other costly and negative adverse events. So that bill, SB 672 by SB 674 by Senator Buckingham is another priority bill of ours related to medication access. The House companion bill is HB 2822 by Representative Hull and Dr. Oliverson. House bill needs a hearing in Human Services, and the Senate bill needs a hearing in the Health and Human Services Committee. So we would love to get some support on trying to get those bills passed as well.
Thank you, Greg. And Marilyn brings up another point with respect to coverage for postpartum mothers, SB 218. There was a pretty comprehensive article in the Austin American-Statesman published either today or over the weekend that addresses this very issue. There are some great facts and figures in there, of course, and basically goes into greater detail in terms of more detail than I went into in terms of explaining the need for this expansion of coverage for postpartum mothers because of the detriment caused by postpartum anxiety or mental health disorders, especially not only on the mother's life, of course, but on their impact on the relationship with the child and the child's long-term health and well-being. So thank you, Marilyn, for bringing that up.
And I'd like to just make a quick comment on that subject as well. Of Medicaid coverage and access to services for women after a pregnancy. The talking points on the screen, really do a great job in laying out why this is an important priority for mental health advocates. There is another bill not specific to postpartum depression like SB 218 is, but more broad around Medicaid eligibility in general for after a pregnancy. That bill is HB 133, and why I'm bringing this bill up is that it's being heard in a public hearing tomorrow at 8 a.m. in the House Human Services Committee. NAMI Texas will be at the Capitol tomorrow morning to register our support for that bill. The bill would extend Medicaid coverage after a pregnancy to 12 months. And it's currently much more limited than that, and that impacts new mothers' ability to access care in a negative direction. So the other thing to mention on that is that if anyone out there is particularly interested in this issue and possibly has a story to share about it, you can, before the hearing tomorrow morning, you can log on to the House Witness Registration webpage and actually write in your position on this bill, HB 133. You can write your comments in support of it, and we'll make sure to provide a link to the webpage that you can use to register your position on a bill remotely. You can do it from anywhere in the state of Texas for any of the House bills that are being heard in committee. So I just want to encourage folks to do that if this is an issue that has, particular meaning for you.
And to follow up on to piggyback on Greg's comments about HB 133, if you do receive the NAMI Texas policy newsletter, a version of that went out on Sunday, and I believe HB 133 was included in that newsletter. And in that newsletter is access to the notice of hearing through which you can access that public comment form. So if you did receive it, if you are signed up or you do receive our policy newsletter, then you already have access to that information. It's already available to you. If you don't, please reach out to me either this evening or tomorrow morning, whatever's most convenient, and I will provide you with that information, a link to the portal through which you can enter your testimony or comments on HB 133 or any of the other bills being heard by Human Services tomorrow. Okay. So Ron mentioned he's the most helpful for, he probably can provide the most help with SB 539 as a storyteller. He mentions the trouble with which he had in finding a provider, loss and discrimination due to PTSD and anxiety. Okay, excellent, Ron. So that's a great storyteller, great information to have in terms of being able to provide a story. Let me go back and check on my registrant list and see where we're at and getting you connected with a group, or where you're at. Your group is X. I don't remember off the top of my head if I've already established a meeting for the group that you're in, or if not. I believe so. Actually, as a matter of fact, I believe so, but I'll double check, Ron, and make sure that we've got you set up for a meeting. And then if you can connect with your group mates about potentially sharing on your experience with PTSD and discrimination, and potentially SB 539. Okay, I don't see any additional comments. It's not too late. We're not trying to, oh, you're welcome, Ron. We don't have any additional more comments or questions so far. We will certainly hang out here for a few more minutes if something does come to mind. But keep in mind, if you don't have something right off the top of mind, you're more than welcome to email me and ask those questions just via email, and I'll do my best to answer in a timely manner. We do have a couple of days, so I don't imagine it'd be too difficult to get an answer back to you before the day of action. If it's in regards to HB 133, of course, time is a little bit more tight. So I would encourage you to email me this evening if you need more information. Greg did drop a link to the public comment form for HB 133 in the comment section in the chat. So you should have access to that. But if you have any additional questions with regards to that Medicaid expansion for postpartum moms, please feel free to reach out to me, and I'll do my best to explain kind of the nuance of that bill, because there are a number of those bills out there. And I can hopefully explain why HB 133 is unique and why it's being heard versus the others. So I can certainly provide you with that information if you email me. It looks like we have another question came in for HB 88. For those of us who have Rep. Goodwin, she is also on that committee. So I don't know if anybody's speaking with Rep. Goodwin. I'm going the wrong way in the slide. I don't believe anybody's speaking with Rep. Goodwin this day of action, but I think probably what Marilyn's referring to is just reaching out independently to Representative Goodwin's office. And you can certainly, she is in House Homeland Security and Public Safety. So for sure, that would be a good person to reach out to and talk to about the George Floyd Act, and share your thoughts or comments or concerns you have. Greg?
And let me make a comment here, because I just looked up HB 88 while you were speaking, Matthew, and I noticed that Representative Goodwin is currently a co-author of HB 88, which is an indication that she is a supporter of the bill already. And so in that case, like if HB 88 is a a big priority for you, the best thing you can do in that situation is thank her for co-authoring the bill. There are going to be a lot of cases where you're meeting with an elected official who has made no indication of where they stand on the bill that you're advocating for. I mean, that'll be the case the vast majority of the time. So, one potential ask that you could make, like if you're kind of laying out the case for a bill and you're picking up on the vibe that the legislator kind of likes what they're hearing and they're nodding their head a lot, you can take it a step further than just asking them to support the bill responsively. You can take it a step further than just asking them to support the bill reactively. You can ask them to proactively co-author the bill. And that can happen in both the House and the Senate. And that can be your request of them. Would you, if you support this bill, would you be willing to reach out to the primary author of the bill and sign your name on as a co-author or a joint author? And you can throw that out there and see what kind of response you get. I think that's a very appropriate ask for any of these bills that we're advocating for. So just something to consider. There's a couple more questions I see in the Q&A.
Absolutely. So I did receive a question from regarding asking if these are the only bills that they can talk about or advocate for in their day of action session. Absolutely not. You can talk about anything that is important to your community or important to you personally. You can speak about anything really with your legislators, of course. The primary thing to keep into consideration or keep into mind when you're making these asks is making a very specific ask. You mentioned this commenter, questioner mentioned HB 1754 and SB 412. I don't know those bill numbers off the top of my head, but yes, if you're going to talk about something outside of what's suggested this evening, make sure you come with a very concrete ask, or you come with a very specific bill in mind that you want to speak to them about and advocate for. So anonymous attendee, I don't know who you are. You're more than welcome to speak about anything, any bills that are relevant to you or to your community or to the organization you work in or work with, volunteer for. Feel free, as long as you make a really solid ask at the end in terms of like, hey, will you support this bill, vote in favor of this bill, or will you, support whatever budget writer we're requesting, whatever the case may be.
And Matthew, I had a chance to look up the bills that were mentioned while you're speaking. So HB 1754 by Representative Hernandez is about inclusion of suicide prevention information on certain student identification cards issued by a public school. So probably what that bill requires is that the suicide prevention lifeline number be made available on student ID cards. I'm thinking this one is probably for public school students, maybe high school students. I know that there's another bill by Representative Hinojosa that we've been helping with that would require this information to be provided on college student IDs. So I suspect we have a lot of folks on this call who would agree that those particular policy proposals are no-brainers. I mean, there shouldn't be any controversy around that. People should absolutely have easy access to that information. HB 1754, the one about putting the lifeline number on student ID cards, is currently sitting in the House Public Education Committee, and so we should be working to get that bill a hearing in that committee. The other bill that was mentioned, coincidentally, SB 412 is about, I believe, audio only telehealth services. So, the idea is that there should be reimbursement, insurance reimbursement for audio only services. And I think SB 412 is Medicaid. I'll have to verify that. Medicaid rather than commercial insurance. We'll check on it, but this is a bill that NAMI Texas strongly supports. We actually signed on to a coalition one-pager in support of this bill today. And if anyone wants that, or you're thinking of advocating for SB 412 in your meetings on Friday, feel free to reach out. We'd be happy to provide you with our information and talking points about the bill, and that could be helpful for you in your meeting on Friday.
Excellent. So last question we have for the time being, at least, is from Jane. Jane, I probably won't distribute the PowerPoint, but what I'm going to do is distribute a handout that contains all the bill numbers, all the bill summaries, and all the talking points in it, just because I feel like it'd be a little bit less cumbersome than having to deal with like a 15-point PowerPoint. You'll just have two handouts, two one-pagers, essentially, that one for the House bills and one for the Senate bills. So you will be receiving all the information that we've discussed this evening, and that'll come out tomorrow with the link to the recording of this conversation as well.
Yes, verified on SB 412. It is around Medicaid reimbursement for audio only behavioral health services. So not commercial insurance. It's about Medicaid. And another question just came in about that bill, SB 412. Why is it limited to audio only for behavioral health? So I don't know, Matthew, if you have insight on that. How I'm interpreting that question is like, why doesn't it address other policy options for expanding access to telehealth services? Like there's another policy issue that comes up around payment parity for telehealth services. Like, from a policy perspective, should behavioral health telehealth services be reimbursed at the same rate as behavioral health in-person services? And our answer to that would be yes, and we're advocating for that in other bills. This is just a more narrow bill that is specifically about Medicaid reimbursement for audio-only behavioral health care. So, like, essentially services like delivered through a telephone that currently provide value to a segment of the mental health population, and that should probably be reimbursed on a permanent basis. Obviously, there are lots of other aspects of telehealth that need to be looked at and addressed if we're truly doing everything we can to expand access to care.
Yeah, I think you hit everything, Greg. And it's worth just making the distinction between audio only and like services provided through like a video conferencing software like Zoom. I think currently all those services are reimbursed because of the emergency orders due to the COVID-19 pandemic. However, I think traditionally audio only is not reimbursable, and the video conferencing, so through like a Zoom, it's at a lower rate than in-person services. So they're trying to create parity in all those different modalities of delivering services. And this is just a more targeted bill, like Greg mentioned, as opposed to trying to do it all in one, which can be an overwhelming and maybe harder to pass. So just focusing on the audio only element. I know HB4 for Representative Price's office is one of those comprehensive bills. And I think it was heard today, or maybe it's heard this week sometime. I don't know if it was heard today, but it's heard sometime this week. So HB4, if there's something that you're interested in, it isn't like, I wouldn't necessarily call it an omnibus bill, but it does contain all of those different elements and creates payment parity or repayment parity. And it does address video conferencing and telehealth services. So HB4 is a really good one to speak to. There is a Senate companion. I don't know the number off the top of my head. All right. Looks like maybe there was something dropped in the chat. Let me see here. Okay, so Melissa McCune was clarifying that telemed, telehealth with video, so video conferencing services are already covered under Medicaid. Maybe the repayment rate is not the same, but they are reimbursed to a certain extent, and audio only is likely not reimbursed at all, just because the powers that be thought it wasn't an adequate way to provide mental or behavioral health services. We're trying to change that, obviously.
And it looks like HB4, which you mentioned, is actually one of the House companions to SB 412.
Okay.
So there's a handful of telehealth bills out there, and some of are fairly specific to mental health. The one we're really encouraging focus on right now is SB 412, and one reason for that, and that's the one that addresses audio only reimbursement. One reason for that is that it's being heard in a public hearing tomorrow in the Senate Health and Human Services Committee. So once it gets that hearing, it's important for us to apply pressure for it to be voted out of committee and moved on to the Senate floor as quickly as possible. So there's a certain, opportunity that we have with SB 412 with there being a hearing on it this week. And it's a good idea for us to take advantage of that opportunity. And we have a kind of small group tonight. If anyone has a question that would be better asked verbally, you can use the raise your hand feature on the bottom. Just if you have a specific question you wanted to bring forward and you'd rather ask it verbally rather than typing it into the Q&A, feel free. We'll give a minute or so for additional questions to come in. There's a question. It looks like HB 133 is first on the list of bills for the hearing. Will it be addressed first at 8 a.m.? Not necessarily. And that's one kind of interesting aspect of the way that bills are addressed in the legislative committee in Texas is you never really know the order in which they're going to be called up. Like, you have the list of 10 to 15 bills that are going to be heard in committee on that day. And they will more often than not, just kind of jump around that list and address bills in whichever order makes sense to them on the day of. So, the 8 a.m. hearing for HB 133, that bill could be called up at 8 a.m. or it could be called up in the afternoon or evening if they don't make it to that bill before 10 a.m., which is usually when the House goes into full session. So, unfortunately, if you want to see the testimony on HB 133, you kind of just have to be prepared for keeping an eye on the hearing for as long as it's going on and listening for the bill to be called up. And for folks who aren't aware, you can always watch these hearings online if it's a House bill, Texas House video website, or there's also a Senate video website for Senate bills. So I don't see any raised hands. Not seeing any additional questions in the Q&A. So maybe we're getting out a little early tonight, just in time for the Maryland basketball game. University of Maryland, go Terps. Shout out.
Right on. Well, if questions do come to mind, everyone, you're more than welcome to reach out to me via email, and I'll do my best to answer them in a timely manner. Again, if it's HB 133, the sooner the better, because that is being heard in committee at around 8 a.m. tomorrow morning. So the sooner you can get any questions you have around that bill to me, the better. But we have plenty of time until Friday if for any other day of action related bills or questions you may have. As I mentioned earlier today, what I'll be doing is distributing a recording of this video session or this session, a recording of this session to all registrants tomorrow, in addition to bill lists. So you'll have all this information for you in front of you tomorrow at some point in time, most likely late morning, early afternoon, at which point you can start your planning process, or if you haven't already started your planning process with your group mates, and you'll have all those talking points in front of you, so you can start to identify the issues you want to discuss if you haven't already identified those issues. Again, if you do have any questions going forward the next couple of days before Friday, please reach out to me and I will do my best to get back to you in a timely manner. And tomorrow's Tuesday, so Wednesday is when I traditionally provide that final email communication with the meeting login information, the exact time, and all the participants and who you'll be meeting with if I haven't already provided that. So keep your eyes on your inbox for the next couple of days. Tomorrow and Wednesday, you'll have an email each day with some really important information. And of course, if you send me any questions, then I'll reply to those, via email as well. But if you don't have any more questions for this evening, feel free to take off. We appreciate you attending and being here with us. And we really look forward to the third day of action and getting out there and changing some hearts and some minds.
And folks, because we're live, I just want to encourage everyone to stay safe out there. We're seeing some severe weather warnings coming through, all going from Austin all the way up to north of Dallas. So definitely keep an eye on the weather, possible tornadoes, hailstorms. So have a safe evening, and we'll look forward to seeing you all on Friday for Day of Action number 3. Take care, everyone. And great job, Matthew. Thanks for leading this.